Welcome back to the Approved Clinical Instructor Training Series. We're going to launch into the overview of the standards related to athletic training clinical instruction. There are 7 of these standards that we'll cover throughout this video series. Standard number 1 is legal and ethical behavior. 2, communication skills. 3, interpersonal relationships. Number 4, instructional skills. Number 5, supervisory and administrative skills. 6, evaluation and performance. And number 7, clinical skills and knowledge. So for standard 1, legal and ethical behavior, this is described as the approved clinical instructor, or ACI, demonstrates legal and ethical behavior that meets the expectations of members of the profession of athletic training. Let's see how this is broken out. Criterion 1.1, proper credentialing. The ACI holds appropriate credentials as required by the state in which the individual practices athletic training. For us, here in California, that would be the NATA Board of Certification Incorporated certification. This is verified annually through submission of the A1 form to the program director. Any changes to this, to your status regarding this, need to be pointed out to the program director immediately. Here's your first assignment for this week. Please go to the website where you'll find the A1 form located. Download the form. Fill in the requested information. Copy or scan your board certification card or a verification letter from the BOC indicating that you've completed your required CEUs, and send that form to the program director or clinical coordinator. Let's look at criterion 1.2. This deals with scope of practice. The ACI provides athletic training services that are defined by the role delineation study and within the scope of the respective practice act of the state. If you'd like to see the role delineation study or have questions regarding appropriate services, let's discuss them on the discussion board or contact the program director or clinical coordinator. The role delineation study divides athletic training responsibilities into 6 different areas. Those areas are Domain 1, prevention. Domain 2, clinical evaluation and diagnosis. Domain 3, immediate care. Domain 4, treatment, rehabilitation, and recognition. Domain 5, organization and administration. And Domain 6, professional responsibility. Let's look at criterion 1.3, practice legally. The ACI provides athletic training services that are consistent with state and federal regulation and legislation. Some examples include equal opportunity, affirmative action, ADA, HIPAA, and FERPA. How are we going to address these? Well, links to information regarding each of these policies can be found on the website associated with this video series. As an athletic trainer, as well as an ACI, you'll want to familiarize yourself with each of these policies. If you have any questions about how these are implemented in your clinical setting, please don't hesitate to contact your clinical supervisor or the program director or clinical coordinator. Criterion 1.4, practice ethically. The ACI demonstrates ethical behavior as defined by the NATA Code of Ethics and the NATA BOC Incorporated Standards of Professional Practice. Let's look at the NATA Code of Ethics for a moment. Let me read you the preamble associated with the code. The National Athletic Trainers Association Code of Ethics states the principles of ethical behavior that should be followed in the practice of athletic training. It is intended to establish and maintain high standards of professionalism for the athletic training profession. The principles do not cover every situation encountered by the practicing athletic trainer, but are representative of the spirit with which athletic trainers should make decisions. The principles are written generally. The circumstances of a situation will determine the interpretation and application of a given principle and of the code as a whole. When a conflict exists between the code and the law prevails. There are 4 general principles related to the Code of Ethics. Let me go over those right now. Principle number 1, members shall respect the rights, welfare, and dignity of all. Principle 2, members shall comply with the laws and regulations governing the practice of athletic training. Principle 3, members shall maintain and promote high standards in their provision of services. And principle number 4, members shall not engage in conduct that could be construed as a conflict of interest or that reflects negatively on the profession.